Hi everybody and welcome to the update from the ANU Medical School from today, the 23rd of October 2020. The travel restrictions from Victoria to the ACT remain in place. The restrictions on Sydney LGAs has changed slightly. Included now are Camden LGA, Liverpool City LGA and the suburb of Lakemba. There are also some hotspots in Sydney. Please check the New South Wales COVID-19 website for those. And if you have been to those areas, remember you cannot be on placement or on hospital grounds working clinically for 2 weeks after the return. Remember to check every day how well you are, and if you have any symptoms, talk to your GP and stay at home. Please also regularly check the ACT COVID-19 website. Now for the students this month, the topic is exams, exams, exams. Good luck to all the students. I know you'll be doing well. Good luck to all the examiners. We will hopefully be celebrating some graduating students very, very soon, and good luck to the year 1s to 3s as well. For the year 4 students this year, there will be no opportunity to do the print or pre-internship term. And for all students, particularly the international students, we strongly discourage you from going overseas during the break. It is not guaranteed that you will be able to come back with quarantine or without, so it would be better to stay within Australia. We have brought the issue of international students having to remain in the country away from their family to the ANU exec, and ANU has now tasked a task force to look at what can be done for international students, particularly during the summer. Also, a message for all students, we expect you to be in Canberra at the beginning of the next academic year. We will not allow you to do as much of the training as we allowed this year from other cities or from other countries. So we expect you to be back, and if you're not back, we may have to consider program leave for you. So please think about your travel plans during the summer break. As you know, ANU has developed a recovery plan and has consulted on that. The feedback is now summarised and available on the ANU COVID-19 website. The Vice-Chancellor and the Dean of our college have had town hall meetings and given you feedback and what this means for ANU or our college. For our college, a white paper outlining the next steps for Transform is due to go to SMG in the next few weeks, and that really outlines the next steps for our college to support our vision. As Professor Gruen said in his town hall meetings in regards to the budget, there are no changes for staffing planned for this year. We're working on the budget and on Transform and on changes that may be required to support our way into the future, and we will consult with everybody on this in January. And just in case you were wondering or thinking about it, the voluntary separation offer is still on the table, and please discuss that with me or with Katrina Chappell, the manager, and with HR if you're interested to look at this option. In the spotlight on our website this week is Professor Michael Kidd. Michael is a Professor of Primary Care Reform with us, but he's also the Principal Medical Advisor and Deputy Chief Medical Officer with the Government Department of Health. And in the article, you can read his thoughts on preparation for a pandemic and plans for the government's 10-year primary healthcare reform strategy. Now, something that Transform will focus on over the next few years is postgrad or executive training. And this is already happening in our college. And it is exciting to see that that is happening as a collaborative effort between us, the medical school, and the Research School of Population Health, where the team and from the med school, that was Anna Olsen, Diana Perryman, Rosalie Aroni, and others, gave tailored training in research methodology to the Health and Medical Research Office at the Australian Government, and they are responsible for the MRFF funding. Good on you, team, and please keep up the great efforts. Health Answers is the ACT New South Wales Education, Research and Service collaboration. And Health Answers wants to showcase what makes your or our community happy and healthy. Anybody who has a camera or even expert photographers are invited to submit photos that represent health medicine in their community. Winning images can receive a gift voucher. There's more information on www.healthanswers.org.au. The competition closes on the 27th November 2020. So get those cameras out and send in your award-winning photos. In the media this week, we had Peter Collignon in ABC's Morning and the Herald Sun, Louise Stone in Adelaide Breakfast Radio, and Sanjaya Senanayake on 2GB Radio. And we're very proud to announce that this year's Allied Health Excellence and Provision of Service to Improve Aboriginal and Torres Strait Islander Health and Wellbeing Award has been given to the Program of Experience in the Palliative Approach, or PEPA, the Aboriginal Torres Strait Islander Media Project at Calvary Hospital, Bruce. And there were some of our academics involved in this, namely Yash Gawarika and Suhasha Kanathigoda. Congratulations to the team, well done. And another winner from the ANU Medical School, the Allied Health Research Excellence Award of ACT Health Directorate, has gone to Dr. Rebecca Ray, who is a lecturer with the medical school. Well done, Rebecca, and congratulations. Now, you would have all received an email from Professor Imogen Mitchell, the substantive director of this medical school, outlining her plans until the end of the year. As you know, Imogen is currently the clinical director of ACT COVID-19, and given that the pandemic is ongoing and seems not to abate in a hurry, she will continue her secondment as there's still a lot of work for her to do. Imogen came to Canberra in 1999, having been in Sydney and in the UK before. She took on the role as a director of ICU, which she kept for 15 years. In 2013 and 14, she was the Harkness Fellow at the Johns Hopkins Bloomberg School of Public Health at Johns Hopkins University. Imogen has been involved in the medical school in leadership positions since 2008, when she was the Associate Dean for Admissions. This was followed of becoming the Associate Dean for Phase 2 in 2012, Deputy Dean in 2014, and she has been our leader for the last 4 years. In her roles with ANU, Imogen has had substantive impact on the development of this school that she should be very, very proud of. Whether it was for her to develop new processes in admissions, develop a governance model around the Phase 2 teaching, or in her role as deputy or as the dean of this school around governance within the school, setting the strategy. As you remember, she has led a few reviews of this medical school, which led us to have some clarity around our finances, around our professional staffing, and we've had an external review of the medical school with some recommendations on how we can continue to thrive. So she has really set the strategy and continued the great work that the previous deans of this medical school have done. It was also under her leadership that this medical school was accredited for another 5 years by the AMC, having met all the requirements and having no further obligations to report on anything. And at the end of last year, she developed a vision for this medical school outlining where we should go, where we can go, and where we will go over the next 10 years. So Imogen will remain a senior academic within the medical school and will particularly continue her research and of course education, and will lead the development of the Academy of Clinical Leadership. For me personally, of course, this is very sad news because I have benefited from her advice and her support. I will remain in this position until further notice, and I will look forward to continue to work with Imogen in her role over the next years. That's all from me for this week. Thank you for watching. Please remember to stay home if you're unwell. We now have a patient with COVID-19 in the ACT. COVID is not over yet and remains a threat to not just the ACT but Australia as well. Remain socially connected, but keep your physical distancing. Look after yourself and others. Get any questions or feedback, please email me. Have a great weekend and I'll see you in 2 weeks.